The urinary bladder is a muscular sac in the pelvis that stores urine. Bladder is located below the peritoneal cavity near the pelvic floor and behind the symphysis pubis. Cancer that begins in the cells of the bladder is called bladder cancer, and it is the 10th most common cancer worldwide. Hello guys, welcome back to yet another episode of Med-Surg Mentor, and today let's see this condition in detail. Bladder cancer is defined as the malignancy in the tissues of the bladder, which is the organ in the body that holds urine. The most common etiology of bladder cancer is mutations in the DNA. Somatic mutations in the genes like FGFR3 and TP53 genes are common in bladder cancer. Each of these genes play a crucial role in regulating gene activity and cell growth, ensuring cells do not grow and divide too rapidly or uncontrollably. Important risk factors of bladder cancer are smoking, exposure to chemicals like arsenic, other chemicals used in the manufacturing of dyes, rubber, leather, textiles and paint products, increasing age, previous cancer treatment, male gender, family history of cancer, and chronic bladder inflammation. Pathophysiology of bladder cancer. Due to etiological factors like smoking and chemical exposure, cells in the bladder undergo mutations in their DNA. As a result of these mutations, the cells multiply rapidly and uncontrollably. These abnormal cells form a tumor that can invade and destroy normal body tissue. Gradually, these abnormal cells spread through the body, and this is called metastasis. Commonly seen clinical features of bladder cancer are blood in urine or hematuria, pink, red or cola colored urine, frequent urination, painful urination, lower abdominal pain, back pain, frequent urinary tract infection, incontinence, tiredness, and weight loss. Diagnostic measures done to rule out bladder cancer are cystoscopy, biopsy examination, urine cytology, CT urogram, retrograde pyelogram, MRI, PET scan, bone scan, and chest X-ray. Complications of bladder cancer are bleeding, infections, bladder perforations, anemia, cystitis, urinary retention, and intestinal obstruction. Medical management of bladder cancer are chemotherapy, radiation therapy, immunotherapy, and targeted therapy. In chemotherapy, both intravesical and systemic chemotherapy is used. Commonly used drugs are methotrexate, vinblastine, doxorubicin, and cisplatin. In radiation therapy, external beam radiation therapy is used commonly. And commonly used drugs in immunotherapy are atezolizumab, avelumab, and enfortumab. In targeted therapy, the drug of choice is erdafitinib. Major surgeries done to treat bladder cancer are transurethral resection of bladder tumor, cystectomy, NEOBLADDER reconstruction, continent urinary reservoir, and ILEAL conduit. First of all, let's see what is transurethral resection of bladder tumor or TURBT. It's a procedure to diagnose bladder cancer and to remove cancers confined to the inner layers of the bladder. Second procedure is cystectomy. It's a surgery to remove all or part of the bladder. Third surgical procedure is NEOBLADDER reconstruction. It is done by creating a new way for urine to leave body by making a spear-shaped reservoir out of a piece of the intestine. This reservoir, often called the neobladder, sits inside the body and is attached to the urethra. Next surgical procedure is called continent urinary reservoir. In this procedure, using a section of the intestine, a small pouch or reservoir is created to hold urine, which is located inside the body. Then a new opening or stoma is created in the abdomen for urine to pass through. The last surgical procedure is called ILEAL conduit. In this procedure, surgeon creates a tube using a piece of the intestine, and this tube runs from ureters, which drain kidneys, to the outside of the body, where the urine empties into a pouch or urostomy bag that is worn on the abdomen. Preventive measures of bladder cancer are: follow all safety instructions to avoid exposure to harmful chemicals. Do not smoke. Take caution around chemicals. Eat diet rich in variety of colorful fruits and vegetables. Limit exposure to unsafe chemicals at work. Drink plenty of liquids. Eat well-balanced diet. Treat recurrent infections. Report symptoms. And increase intake of omega-3 fatty acids. Important nursing diagnoses for patients with bladder cancer are: acute pain related to the inflammatory process, impaired urinary elimination, dysuria related to disease condition, activity intolerance related to pain and weakness, disturbed sleeping pattern related to urgency and pain, imbalanced nutrition less than body requirement related to pain, knowledge deficit regarding disease condition and treatment, fear and anxiety regarding surgical process, and grieving related to perceived potential death of patient. Nursing cares for patients with bladder cancer are: ensure adequate hydration, monitor bladder function and output, check blood values including hemoglobin, provide non-pharmacological comfort measures, ensure use of stress management skills or complementary therapies, evaluate pain relief and control at regular intervals, administer analgesics as indicated like opioids, non-steroidal anti-inflammatory drugs and corticosteroids, promote adequate rest and exercise periods, avoid or limit invasive procedures, and administer antibiotics as indicated. Today we have seen regarding bladder cancer. It is a common type of cancer that begins in the cells of the bladder. Common clinical features are hematuria, frequent urination, lower abdominal pain, and back pain. Common managements are chemotherapy, radiation therapy, immunotherapy, targeted therapy, and surgery. Hope this video was informative. Thanks for watching, and please don't forget to like, share, and subscribe to my channel. Thank you.